So when giving an enema, you want to make sure to start by clamping your tubing if it's not already clamped. And then once you do that, you will want to place between 750 to 1,000 milliliters of warm water or saline for an adult enema into your bag. Alright. Then you'll want to pour some soap in there. And then at this point you'll want to gently agitate the bag to mix up the soap. And then you'll want to prime your tubing just to make sure that it works. So you'll unclamp. Alright, and it does work, so we're going to clamp it back. And then at this point you would want to lay your enema bag on something hard and flat, or hang it up on the IV bag, or hang it up by an IV stand, IV pole. And then you want to put your gloves on. And you want to make sure that your patient is lying in left lateral Sims position. So they're probably laying on their back at this point, so you just want to have them take their left leg and throw it over their right and rotate over so that they're laying on their stomach with their right leg kind of bent up. And then you'll get them to put their left arm behind their body, kind of like this, and then they'll have their right arm up, like they're in a swimming position. So then after you position them, you'll want to grab your enema tubing with your dominant hand, and then we'll lubricate with our non-dominant hand. You want to make sure to get a generous amount on there. Alright, and then after you do this, you'll want to take your non-dominant hand and you want to place it on the patient's hip firmly but gently, and just let them know to breathe slowly and deeply throughout this process. You'll take your non-dominant hand. After you've told them this, you'll want to spread their buttocks apart, and you'll take your lubricated end and you're going to insert it into the rectum 3 to 4 inches. If the patient has hemorrhoids, just let them know that they can bear down to help facilitate this process. Then at this point, you would continue to hold the tubing in the rectum the whole time, and then you can remove your enema bag off of your flat surface or take it off of your IV bag. You're going to want to hold it 12 to 18 inches above the patient's rectum. And then just let the patient know that if they have any abdominal pain, to let you know. And if they do let you know that they are having some abdominal pain or cramping, you're going to want to lower the bag and put your clamp back on. And this just stops the water. Just tell them to continue breathing slowly and deeply. And if once the pain has subsided, you can begin again. Just make sure to try again before completely stopping the process. If they are having too much pain after you try again, then you can go ahead and stop the process. But just make sure to lower the bag and let them breathe for a minute before starting again.